Osce is the objective structured clinical examination, which is really important for medical students because in this particular case, we are starting to learn how to behave with the different situations, especially when we have different kinds of the patients. And generally, in this particular case, we are trying to help students as much as possible to be adapted with the clinical situation. For this particular examination, we always need to have so-called standardized patients, and the standardized patients are the people who are previously trained for getting to know the certain diseases, in which particular case they have to present them to the students. In this case, we mainly give them the cases in which they have and know all the signs and the symptoms of the diseases, as well as they know how to play and simulate this particular signs and the symptoms of the diseases. And of course, we also help in some cases to give the special cards which cannot be simulated with the patients themselves. It's very important because there are certain diseases which has a very specific signs and the symptoms, and students have to know that particular part for using this in the clinical settings mainly.
We had an Osce examination which involves taking patient history as well as physical examination. After this, we have to write about diagnosis of our patients, our differential diagnosis, as well as some laboratory tests which would help us to diagnose our disease. This also involved ethical cases. We had two different ethical cases, one of which included breaking bad news to the patient, such as newly diagnosed HIV, tuberculosis, etc. And the second ethical case was about discussing to the patients about some operation and if he wanted to undergo operation, etc. I think all of this is a great practice which can help you in everyday clinical practice, and I think it will help you in USA as well. And when I went there, I was much more confident than the rest of the students who don't undergo such examinations.